Okay, this morning we're going to be demonstrating how to do our 5 rights, 3 checks and administer to the patient. And so with that, we're going to start with going to the nurse's station. And while I'm at the nurse's station, I'm going to be checking my doctor's orders to my MAR. And so I'm going to start with Anna Taylor, room 106, Dr. P. Potter. Admission diagnosis, uncontrolled diabetes 2, abscess to abdomen, right forearm, chest pain, pneumonia, and date of birth 4/24/1991. Medical record number is 3335899. No known drug allergies. And so I'm just going to go over to my MAR and just verify that that is still correct. Anna Taylor, date of birth 4/24/1991. Medical record number 3335899, no known drug allergies, and admission diagnosis uncontrolled diabetes 2, abscess to abdomen, right forearm, chest pain, and pneumonia. Okay, so now I'm going to go ahead and just read my initial orders. So Anna Taylor, date of birth 4/24/1991. She was admitted with a history of MI, complained of chest pain, rule out MI, pneumonia, right lower lobe. Okay, vital signs Q4 hours, AccuChecks before meals and at bedtime. Labs, renal, hepatic labs, potassium, PTINR in the AM. Diet is a 2-gram sodium cardiac diet, and activity is bed rest. Okay, so that's what I'll need to know as far as taking care of my patient and what labs I need to be looking at. And so now I'm ready to start doing my my med checks. Anna Taylor, date of birth 4/24/1991. No known drug allergies. Excuse me. Have NPH insulin 14 units subcutaneous before breakfast and evening meal. Okay, I'm going to go to my MAR. I've got Anna Taylor, date of 4/24/1991. No known drug allergies, NPH insulin 14 units, subcutaneous before breakfast and evening meal. So it's before breakfast and evening meals. That means it should be on my MAR twice, and it is. It's at 9 o'clock and 1800, so that is correct. I've got Anna Taylor, date of birth 4/24/1991, no known drug allergies. I have Ketorolac 30 milligrams IM TID for inflammation. I'm going to go back to my MAR. Anna Taylor, date of birth 4/24/1991, no known drug allergies. I have Ketorolac 30 milligrams IM TID for inflammation. TID means 3 times a day, and I have it on my MAR for 3 times a day, 9 o'clock, 12 o'clock, and 1800, so that matches. I have Anna Taylor, date of birth 4/24/1991, no known drug allergies. I have metoprolol 100 milligrams PO BID, hold if apical pulse less than 60 or systolic blood pressure less than 100. So back to my MAR, Anna Taylor, date of birth 4/24/1991, no known drug allergies. I have metoprolol 100 milligrams PO BID, hold if apical pulse less than 60 or systolic blood pressure less than 100. So BID means twice. So I need to make sure it's on my MAR twice, and it is 9 o'clock and 1800. So that matches. Let me go back, and Anna Taylor, date of birth 4/24/1991, no known drug allergies, and I don't have any other meds. And so I can go back to my MAR, and I can say that I verified that my MAR matched what my doctor's order said. Okay, so so I've made sure that it matched, so I'm going to go ahead and put my initials, and my first initial, last name, and my credentials. You would put your credentials according to the program that you're in, okay? So once I've said that my MAR matches, so I've verified that it matches my MAR, or my doctor's orders. So then I'm going to go down here to the bottom, and I'm going to put my initial again, my last name, my title, and then my initials. That way, anybody that comes along and I'm not there at the hospital or it's the next day, and someone needs to know who gave that medication. When I initial it up here, they can look and say JB and know who that is, okay? So once I have verified my doctor's orders and made sure my MAR matched, okay, and I verified my MAR and I've signed down here, then I'm going to go ahead and shut down my computer, and I'm going to go to the med room, okay? When I get to the med room, I'm going to go ahead and do a medical hand wash. Now, as a student, the nurse will have pulled all your meds for you, and she'll have it in a drawer like this, and so you need to find the room number on there. So once I'm going to go ahead and pull my computer back up, and I'm working off of my MAR now, okay? So I'm going to go ahead and get this kind of over here a little bit. Get this. Okay, so I did my medical hand wash when we came in. I pulled my MAR back up. Now we're going to go ahead and start doing our first two checks. First two checks are in the med room, and so my nurse has pulled my meds, and so I'm going to start with my first one. And so my 5 rights, name, date of birth, allergies kind of in that, and then the med, the route, the time, name, date of birth, drug, amount, and route, and time. Okay. Okay, so then I'm going to look at Anna Taylor, date of birth 4/24/1991, no known drug allergies. I've got MPH insulin 12 units sub-Q before breakfast and evening meal. I'm going to be giving the 9 o'clock dose, okay? So I have MPH insulin, it's U100. And we're going to be giving 14 units sub-Q before breakfast and evening, and I'm giving the 9 o'clock dose. So in my hand, I've got Practi MPH insulin U100, okay? I'm checking for the expiration date, which is 20/20/25, and it's intact, okay? And so that is correct. This is a brand new bottle. And so with that, I'm going to need to use an insulin syringe, and this one is a U100, so it matches the U100 that I have in my insulin, and it is intact. The expiration date is 11/22/2025, so it is good. And just in case, because that needle is really small, I brought a second one in, so I'm just going to double check. It's an insulin safety syringe. U100, which also matches my U100. Expiration date is 11/22/2025. Okay, it's intact. And so with that, I'm going to go ahead and draw up my meds. Now, you don't necessarily have to put gloves on, but if you feel like you're going to come in contact with any of the medications, then you can go ahead and put gloves on. I don't think I'm going to with this one, but just in case, okay? All right, so with MPH insulin, it has a precipitate, and so we need to mix it. So you roll it, you never shake it, because then that puts little air bubbles in there. So we're going to roll it to make sure all the precipitate. So now where it was clear and then just had the precipitate, it's cloudy, okay? So MPH insulin is cloudy. And we're going to scrub the top, and then I'm just going to leave that alcohol swab on there. Again, I've already checked my syringes. Okay, so it's saying that I need 14 units. So I'm going to pull back 14 units of air. Now that needle is very tiny, so you have to be careful. I'm just going to set that down right there. And we're going to put that in. We're going to put the air in. We're going to turn it over, being careful with that needle. I always put it in the light so I can see. So with this one I can actually overdraw, and I want to make sure that looking in the light I don't have any air bubbles, and I don't in that one. So I'm going to go ahead and make sure that I have 14 units. And so because insulin is so critical, you need to have 2 licensed personnel verify. So I'm going to ask my first license, what do you see? I want them to tell me what they see. So they see NPH insulin and they see 14 units, okay? I go to my second licensed personnel, what do you see? They say they see NPH insulin 14 units. So with that NPH insulin 14 units, I know that I have got the right amount. Now very carefully, I want to make sure I don't touch the needle, and we never recap two-handed, okay? So I've got my lid on there, and I need to label my syringe, okay? So this is NPH insulin, 14 units. NPH insulin, 14 units. The route is sub-Q. The time scheduled is 9 o'clock, and my initials. And I'm going to take that, and I'm going to make sure that I put it where I can still see how much. And I'm going to put this down here so I can read my label on my second and third check. And this little piece right here is a safety device, so after I give it, then I can deploy that, so you never recap a used needle. This one we can't change the needle, that's why we had to recap it, but we recapped it one-handed without making sure the needle touched on the outside of that, okay? So once we have completed that, we've done our first check on our insulin, and now I'm going to go to my next one. And before I start that, I'm going to go ahead and, because this is brand new, and I popped the top off, and so we check the expiration date for the vial. But insulin is only good for 30 days from the time that you open it. So I need the date, time, and put my initials. And so with that, I'm going to put that on my vial, so the next person that uses this will know that yes, the vial is still, the expiration date is still good, but we've got to check the expiration date to make sure it's still within the 30 days from opening this, okay? All right, so now I'm going to go to my next medication. I have Anna Taylor, date of birth 4/24/1991, no known drug allergies. I have Ketorolac 30 milligrams IM TID for inflammation. I'm giving the 9 o'clock dose. So in my hand I have Ketorolac for injection, because it's supposed to be for injection, IM, for IM or IV use, okay? It's 30 milligrams per 1 meal. And I'm to give 30 milligrams, so 30 milligrams per 1 meal means I need to give 1 meal. And I have expiration date 8/25 of 2025. So it's intact, okay, and it matches, okay, so 30 milligrams, we're giving that IM, and we're going to give that at 9 o'clock. So I need to get my syringe, and again I've checked the intactness of my syringe. I've checked for the sterility, okay, and this is expiration date of 2027. And I've got, this one doesn't have a needle attached, so I need to make sure I have a needle that I can draw up with, and then I have a needle that I'm going to actually give with. So with each one of those, I've got a 21 gauge 1 inch. Expiration date is 2027. The package is intact. The one I'm going to give with is a 22 gauge 1.5 inch. Package is intact and expiration date is 2025. Okay, so we're good with that, right? So the first thing I'm going to do is, again, I'm going to clean the top of my vial. Okay, scrub a little bit, then just leave that on top of there. And then very carefully, I'm going to open up my syringe. Take this out. This part right here is what needs to maintain sterility, okay? And so we're going to open up the needle, so very carefully. Now that needs to be sterile, this needs to be sterile, so, and this is a lure lock, so we're just going to lock it in place, okay? And since this says it's 30 milligrams per mil, I'm giving 30 milligrams, so I need to pull up 1 mil, okay? Oops. Okay, so I'm going to pull up 1 mil, okay? And I'm going to put that in there. Okay. And then I'm going to make sure that my needle is in the solution, and I'm going to draw back. So this needle is a lot more sturdier than that other one, so I'm going to go ahead and get all the air out, push that air back up into the vial, make sure my needle is back in the solution, and I'm going to pull back to 1. Okay. Now with this one, I'm going to go ahead and deploy my safety, okay? And I'm going to have my other syringe or my other needle right here, okay? So without touching, this is the one I'm going to give with, okay? We're going to make sure I don't touch that part right there. Put that on there, okay? And I need to, so I'm going to take my meds with me, because you never leave your meds unattended. And I'm going to go ahead and come over here, put that in the sharps container. Okay, and we're still in the med room, so I still have 1 mil, okay, and I've got my medication here. So I need to label. So this is the, I'm just making sure I've got it spelt right, because there's a lot of look-alike, sound-alikes, and it's 30 milligrams and per 1 mil. So I put 30 milligrams per 1 mil because that's what it says here, 30 milligrams per 1 mil. I'm to give 30, and I know that if I give 1 mil, I'm giving 30. This one is IM, and the time scheduled is 09 o'clock, and my initials. Again, I want to put the label below the level of the medication so that I can verify that I still have the right amount in there, and I want to make sure that I can still read my label, okay? So once we have done that, because we opened this vial and it's a multi-use, we're going to go ahead and if I can get my tape going here. Again, we're going to date, time, and my initials. So if there was any questions, and people would know when this was actually opened, okay? so that was just an extra if we needed it. All right, so our next medication, Anna Taylor, date of birth 4/24/1991, no known drug allergies, metoprolol 100 milligrams, PO, BID, hold if apical pulse less than 60 or systolic blood pressure less than 100. I'm giving the 9 o'clock dose, and in my hand I have metoprolol 100 milligrams, expiration 2/20/2025, and that matches. And you see I'm holding it up here close because there's a lot of look-alike, sound-alike, so I've got to make sure that those are matching, okay? So metoprolol 100 milligrams, Anna Taylor, date of birth 4/24/1991, no known drug allergies, metoprolol 100 milligrams, BOBID, hold apical pulse less than 60 or systolic blood pressure less than 100. I'm giving the 9 o'clock dose. And again, I've got metoprolol 100 milligrams, expiration 2/20/25. And the package is intact, okay? So now that I've done my first check, I'm a creature of habit, so as I do my first check, I'm pulling the meds out of my my bin, and then that way I can look to make sure I didn't miss anything, make sure I haven't missed anything. You always want to go in order. You don't want to bounce around, so that way you can keep yourself straight. My second check, as I check it, I'm putting it back into my bin, and we would leave that into the med room. Okay. So now that I've done my first check, now I'm going to go ahead and do my second check on my medications, okay? So I've got Anna Taylor, date of birth 4/24/1991, no known drug allergies. I have NPH insulin 14 units, subcutaneous, before breakfast and evening meal. I'm giving the 9 o'clock dose. In my hand, I have NPH insulin U100, okay? Expiration date it had not expired, okay? Since this was a new one, I had date timed and initialed, okay? And that is correct, NPH insulin U100. So in my syringe, I have NPH insulin, 14 units, sub-Q. I'm giving the 9 o'clock dose, and I've got my initials, and then I'm going to verify that I still have 14 units, okay? Because it's easily push the plunger up, and so we have that. So once I've done that, I'm going to go ahead and put that into my bin, and I've done my second check on that one. So Anna Taylor, date of birth 4/24/1991, no known drug allergies. I have ketorolac 30 milligrams, IM, TID for inflammation. I'm giving the 9 o'clock dose. In my hand, I have the ketorolac 4 injection, 4 IM or IV use, and I'm giving this IM, so that's appropriate. 30 milligrams per 1 meal, expiration date 8/25/2025, okay, and it's intact. I've labeled it from the date and time that I opened this, okay, and so the ketorolac matches the ketorolac, 30 milligrams per 1 meal. I'm going to be giving 30 milligrams, so I should have 1 meal. So in my syringe, I have ketorolac, 30 milligrams per 1 meal, and I still have 1 meal. It's IM, it's the 9 o'clock dose, and I have my initials on there. So that is my second check for that medication. So my third check, I have Anna Taylor, date of birth 4/24/1991, no known drug allergies. I have metoprolol 100 milligrams, PO, BID, hold if apical pulse less than 60 or systolic blood pressure less than 100, and that's 60 beats per minute, and that I'm going to be giving the 9 o'clock dose. So in my hand, I have metoprolol 100 milligrams, expiration 2/20/25. My package is intact. That is my second check, okay? So once I've completed, made sure I don't still have anything on there, glove to glove, skin to skin, I'm going to do a medical hand wash. I didn't really need my gloves because I did not touch any of the medications, but I had them on just in case. So I'm going to do my medical hand wash, taking those gloves off. So since I'm in the med room, now I'm going to go ahead and close out my chart. And as I'm leaving the medication room, I'm going to go ahead and wash my hands again. So you never leave your meds without watching them. So if I had to leave, I would always take my medications with me. But we're leaving the med room, we've done a medical hand wash, and so now I'm going to go ahead and go to the patient's room, okay? All my stuff that I need. Okay. Knock, knock, knock. Good morning. My name is Jan Bucks-Kemper. I'm a registered nurse, and I'm here to give you your 9 o'clock medications. So as I walk in the room, I'm going to go ahead and do my medical hand wash. Like I said, we're here to give you your 9 o'clock medications, and so let me pull your computer up real quick. Okay, and so let me get your band so I can see those. I'm going to go ahead and put where it says scan right here. At the hospital, you don't necessarily have to do that, but here's where we scan. So can you tell me your name and date of birth? Anna Taylor, date of birth 4/24/1991. Okay, she said Anna Taylor, date of birth 4/24/1991. And I've got Anna Taylor, date of birth 4/24/1991. That matches. Now, Miss Taylor, are you allergic to any kind of medications? Not any? Okay, so it says no known drug allergies, and I have no known drug allergies, so that matches. And I'm going to go ahead and scan your ID, and so it's scanned there, and it has 3335899, and we have 3335899, so that matches my MAR as well. Okay. So, Miss Taylor, like I said, I'm going to be giving you your 9 o'clock medications, but before I can do that, I'm going to go ahead and do my third check on these medications, and then once I do the third check, then we'll start giving you, I'll teach you about your medications, and then we'll start administering those, okay? All right, so the first medication I have is Anna Taylor, date of birth 4/24/1991, no known drug allergies, NPH insulin 14 units subcutaneous before breakfast and evening meal. I'm going to be giving the 9 o'clock dose. In my hand, I have Practi NPH insulin U100. We'd already checked the expiration dates good. We know that this is for good for 30 days. And it's the NPH insulin U100. So in my syringe, I have NPH insulin, 14 units, which matches my 14 units sub-Q, 9 o'clock dose, my initials, and I'm going to make sure I still have 14 units, okay? So once I've done that, I'm going to go ahead and come over here on this side where it says med scan, and I'm going to scan my med. Now, occasionally, these might not scan. In this case, it's not going to. So I'm going to type in the number, okay? Five, 6, 7, 8, and then 1, 0, okay? So just making sure that I have that. That is correct, okay? So that is my third check. So we do a third check and we scan, okay? Then my third check, Anna Taylor, date of birth 4/24/1991, no known drug allergies. I have Ketorolac 30 milligrams IM TID for inflammation. This is going to be, I'm giving the 9 o'clock dose. In my hand, I have Ketorolac injection for IM or IV use. It is 30 milligrams per 1 meal. Okay, so that means I'm going to give 1 meal. And the expiration date was 8/25/2025 of date, time, and initial because it's a multi-use vial. Okay, so in my hand I have Ketorolac. It's 30 milligrams per 1 meal. And I still have 1 meal. So with 1 meal, I'll be giving the 30 milligrams that's ordered. The route is IM, the time scheduled is the 9 o'clock dose, and my initials, okay? And so I'm going to, again, scan. Okay, and that one did not scan as well, so I've got 79563. Okay, and so I've made sure 79563, that matches, okay? And so then my last med that I'm going to give is Anna Taylor, date of birth 4/24/1991, no known drug allergies. I have metoprolol 100 milligrams, PO BID, hold if apical pulse less than 60 or systolic blood pressure less than 100. I'm giving the 9 o'clock dose. In my hand, I have metoprolol, 100 milligrams, expiration date 2/20/25. Package was intact, and so that is good. And that one was able to scan. So I've got my cup for that. So now that I've done my third check on all of my medications, and I make sure that I don't have anything left in my bin, I don't, okay? So I'm gonna go ahead and do another medical hand wash. Okay, Ms. Taylor, we're going to be giving you 3 medications. So I'm going to explain those. We're going to talk about where the different sites are that we can give these. And so let me get my gloves on. Okay. Let's scoot my computer over just a little bit, and I'm going to go ahead and raise the bed up to a good working height for me. Okay, and I'm going to go ahead and raise the head of the bed up just a little bit. Okay, so the first medication that we're going to be giving you is NPH insulin, okay? This is for your diabetes. Have you been giving yourself insulin shots at home? You have? Okay, all right, so, but let me talk a little bit more. So NPH insulin is an intermediate NPH or insulin, and so the onset is 1 to 2 hours. The peak is 4 to 12, and then the duration is 18 to 24. Okay, so with that being said, we need to make sure that you're going to have your tray, and I noticed the tray is out there. Let me take just a quick look real quick, because with this one, we need to also make sure that we have checked your AccuCheck before meals and at bedtime. And so when they came in and they did your blood sugar this morning, okay, so we're going to be doing that before meals and then right before you go to bed, so 3 times a day, and then at night, so 4 times they're going to check your blood sugar, okay, AccuCheck. And so this morning it was 100, and so that's good, okay, and we want to keep it that normal range right there. Also, the other things that insulin can work with is renal and hepatic labs. So your bilirubin and creatinine, and your ALT and AST, and then it also can affect your potassium. Your potassium was normal, and then one of your other ones, the ketorolac, can kind of changed your PT and INR, which is a bleeding time, and so they're going to be doing that in the morning. So we've checked all of your labs to make sure that we can give these, and that finger stick, if it was too low, we wouldn't be able to give it to you, okay? So again, we're going to be, this is sub-Q, so we're going to be giving this in your subcutaneous tissue. There are several spots that you can give this, okay? One is finding the acromion process, drawing an imaginary line to your elbow, and anywhere back there you've got like 8 spots that you can give that, and that's on both arms. And then we can also, and you probably, where do you get, we've got privacy, and I'm just going to raise this up real quick, okay? where do you normally give it at home? In your stomach? Okay, so we're gonna avoid that. We'll probably do it in your arms, all right? So I'm gonna divide, I've got your belly button, I'm gonna divide your abdomen into 4 quadrants, and I'm gonna stay at least 2 inches away, and so anywhere, there's like 8 spots that we could do that on your abdomen, okay? And then also another spot that you might use as well is your anterior portion of your thigh here, okay? There's different spots that you can give that in with that, okay? All right, so now they've been giving you this, so where did you get your insulin last? You got it in your left arm? Okay, so we'll give it in your right arm, okay? And so a little bit more about insulin. It is for your diabetes. And so some things that we're watching for is with diabetes, hyperglycemia, which is increased blood sugar. And so, you know, sometimes you can get confused, irritable, even unconscious, depending upon how high your sugar gets. Also, sometimes you may have excessive thirst, excessive hunger, and then with that thirst, it makes you go to the bathroom quite a bit. Sometimes if your sugar's really high, you can have fruity smelling breath or even fruity smelling urine too, as well as that, okay? So if you have any kind of sweating, confusion, of course we're going to be watching for that. You may not be able to tell us that. But once we give this insulin, it's going to bring your sugar down, which it was at 100, and we want to keep it at that normal range. And that's what this is doing, is it keeping it in that normal range. Again, once we give it, we're going to make sure you get a breakfast, which is outside. We'll bring that in as soon as we get done. It will bring your blood, if your blood sugar drops too low, it's called hypoglycemia, which is low blood sugar, and it can kind of mimic the same as hyper as far as confusion, irritability, even unconsciousness. You may have some, so those kind, but then it's specific, as with high you have the fruity breath. With low, you may even have some tingling and numbness in your hands and your feet, and sweating, and then just decreased level of consciousness, not maybe really understanding, confusion, okay? So those are things that we are going to be watching for as well, and we'll teach your family to also look at those kinds of things, okay? All right, so with that, we showed all the different sites, and again, we're going to give it into the right arm. The next medication, before I start giving, I'm just going to teach about all of them. The next one is the ketorolac, okay? And this is, you're getting this because your inflammation, okay? And this is an NSAID, okay, non-steroidal, an NSAID, yes. And so we're going to check to see. Sometimes this can cause, it can actually cause swelling, it can cause some rashes, and so swelling of the face, rashes, but with this, it's an anti-inflammatory. So are you in any pain right now? On a pain scale of 0 to 10, 0 being no pain, 10 being the most pain, what would you consider your pain level? Okay, a 3. Okay, so we're going to go through what we call caldera, so the characteristics. So can you describe that pain to me? Okay, achy, okay, and then the onset. When did you start having the achiness and everything? With the cold weather that just came in? Okay, so that came in yesterday, so that happens every time the cold weather comes in. Okay, then the location. Where's the inflammation? Where's that pain at? Okay, in both your knee joints. Okay, so the right and the left knee kind of have that achiness in it. Okay, and you would have the same pain level in both of them. Okay, and so the duration. So is it constant? Is it intermediate? So it's just kind of dull, achy, constant. Okay, in both knees. Okay. And then exacerbation, what makes it worse? the cold weather, okay, and sometimes when you get up and walk, all right, so the exacerbation. Then what relieves that pain? What do you normally do to relieve it? You take pain medic, or you take NSAIDs at home, okay, and then sometimes you put heat on there, okay. Well, we'll pass that information on, okay. So does it radiate anywhere from your knee joints, or does it just stay in the knee? It's just in the knee, okay. So exacerbate, relieves, radiates, and then is there any associated signs? Does when it's aching like that, does it make you nauseated? Does it make you have a headache or anything like that? Okay, all right, so that's good. So we've done our Caldera. We'll be ready to give that medication, okay? Again, it's an NSAID, and so we will check for any swelling, any redness, rashes, or anything like that. The next med we're going to be giving you is your metoprolol. The metoprolol, it's 100 milligrams. Now this is your, it is a beta blocker, and so with that, it lowers your blood pressure. And I'm just going to walk around the bed, and I've evaluated my patient is oriented, and they are cooperative, okay? And so with this, it lowers your blood pressure, and it also lowers your pulse, okay? So we're going to be teaching you how to take your blood pressure and also how to take your pulse at home before you give this medication, all right? Some of the things that we'll watch for the fact that it does decrease your blood pressure and your pulse. Sometimes you can get dizzy until you know how this kind of works. So with that dizziness, we want to make sure you call for help before you, I'll be right back, before you get out of bed. Okay, and we'll probably put you on fall precautions because we don't want you falling, but make sure you call before you get up. And we're going to change your position slowly, okay? And make sure you don't get dizzy when you change positions, especially when you're standing up as well. And we want someone to help you. So we'll put a yellow gown on. You'll have a fall precaution armband on. We're going to get you some non-slip socks to put on. We'll put a sign on the door, okay? This also can sometimes cause you to have weight gain, so we will check your weight daily. We're going to do eyes and nose, which is intake and output, just to make sure that you're not having any problems with that. And earlier when we did your physical assessment, we noted that you didn't have any swelling or anything like that with our physical assessment. Okay, so I've cleaned my stethoscope. Make sure it's on the right side. Let's get this all untwisted here. Okay, I need to put that where I can see it. Good. Okay, do you know what your blood pressure normally runs? You put it over here. There we go. Okay, and find your antecubital. Okay, it's tight. It's 120 over 80. So the parameters are that if the systolic is less than 100, then we're to hold it, but the systolic was 120, so we're able to go ahead and give that. And I'm going to go ahead and just pull this gown down because I need to do your apical pulse, okay? As a nurse in the hospital, we have to check your apical pulse. We'll teach you how to do your radial pulse before you go home, okay? So I've got privacy, and I'm going to go ahead and I'll get my trash here in just a second. So I'm just going to expose you for just a little bit here. And so I'm going to come down, I'm going to go to the second intercostal space. I'm going to go down to the third intercostal space, the fourth intercostal space, the fifth, and I'm going to follow that rib around and go mid-clavicular to the apical pulse right there. And we're going to count for 1 full minute. Okay, and I got your apical pulse at 80, and the parameters on that one is if your pulse was less than 60, we would have to hold it, which it's not, so we are able to go ahead and give all those medications. Okay, let me go ahead and just took those gloves off, so I need to, last thing I need to do is, we talked about the sites to give for your sub-Q, and we need to talk about the sites for your IM. And so the IM is going to into the muscle, okay, and there's different spots that you can give. So one of them is in the deltoid, and so you're going to put 3 fingers down below that acromion process, okay. And then we're gonna, where that bottom finger is, we're gonna draw an upside down triangle, okay? We're gonna check that muscle, we're gonna check that site, make sure there's not any redness or any bruising or any kind of knots that we feel underneath there. Typically, the deltoid we typically use only for immunizations, but you can give at least one. But because we're giving the Ketorolac, we're not going to use this up here, even though it's 1 ml, okay? Typically, again, that's typically used for immunizations in the deltoid. The other spot that we can give is the vastus lateralis, okay? And we've got privacy. So I'm going to put one hand above the knee and one hand right here at the groin. And right here on the top, and then I'm going to put an imaginary line from my thumbs here, and on this lateral side, and this muscle right here, that's the lateral yeah, I'll spit it out in a minute. Vastus lateralis, there we go. And so again, I'm going to evaluate the site there, all right? The last site and this is the site that we normally give in, is in the ventral gluteal, okay? And I'm going to call someone to come in to help me turn you because you are just a little bit heavy. And so in the video, you just have the person roll over. So I'm going to bend the knee, and I'm going to have them reach over to touch that right there, okay? And so I'm going to demonstrate here for just a minute, but so you're going to use, so this is the right hip, so you're going to use the left hand, okay? You're going to find the greater trochanter right here, which is the hip joint. You're going to put your palm on that spot. So typically we've got them over on the side. You're going to bend the knee so it kind of helps relax that muscle, okay? You're going to put the, so this is my right hand, or my right hip. I'm going to use my left hand, okay? I'm going to put my palm on the greater trochanter. I'm going to put my thumb towards the groin. Then my index finger is going to go up here on the iliac crest, okay? So sometimes the women, or if you have smaller hands, you may need, so this is the point, but I need to take my finger up to the anterior iliac crest, okay, up here. Then I'm going to spread my fingers. So again, spread my fingers, and right here between my V is where I'm going to get it. So I'm going to check that muscle, okay? And make sure there's not any knots, make sure there's not any redness there. And so, did they give this to you yesterday? Okay, because it is actually 3 times a day. So, where did they give the last one? I'm just going to get you back straight here. There we go. So you have good body alignment. No wrinkles. Okay, so they gave it in your left ventral gluteal. Okay, so we're going to give it in your right ventral gluteal, okay? So those are the different sites for the IM injection. The ventral gluteal, vastus lateralis, those can have, typically we give up to 3, and then depending on the hospital policy or the medicine, you don't want to give more than 3. You may have to divide it up, okay? But we only have 1 milligram. Okay, so we have met all the criteria. Our labs were okay. Our blood pressure was okay. So I'm going to go ahead and sit you up. Okay? And I'm going to go ahead and real quickly do a medical hand wash. I'm going to sometimes it's hard to get these pills open. Okay, so we met all the criteria, labs were good, and we've already done our 3rd check and scan, so I'm going to go ahead and open up this metoprolol. Okay, get you some water. Okay, do you have any problem swallowing? No? Okay. And you want a sip of water here? Okay. Oh, got that down okay? All right, do you want me to help you? Okay, so there we go. And here's some more water. Oh, okay, good. So did we get that down? Okay, I didn't have any problems with that. Can you open your mouth and say "ah" for me? I'm just checking to make sense, because sometimes, you know, when your mouth's dry or anything like that, it can kind of get stuck. So we will make sure it got down good. Okay, good. All right. And so the next one we're going to be giving is your insulin. And since I potentially kind of maybe touched your mouth, I'm going to go ahead and change gloves. We don't want to cross-contaminate. And you always want to make sure that you have your gloves on when you are giving any injections. Okay, we're going to start with your subcutaneous, your insulin. Okay, so we've already identified all the sites. And with this one, with sub-Q, you can do a 45 to a 90, but insulin, because the needle is so small, it's recommended to do it at a 90 degree. So I'm going to go ahead and I'm going to put this in my finger over here, and I'm going to go ahead and pinch. We're going to start at the inside and we're going to work outwards. So we take let me start that over here. Get that trash over here so I can get to it easily. Okay, so we're going to pinch it. Start from the inside working out, so we take the germs away from where we're going to actually do this. I'm going to go ahead and take that out, and with a quick darting motion, I'm going to go ahead and go in at a 90 degree angle. 1, 2, 3. We're going to go ahead and inject. Okay. We're going to take it out, and we're going to deploy the safety on that. Okay. You never recap a medication, okay? So keeping my meds in my line of vision, I'm just going to go ahead and walk away or walk around. My patient is still, I can still see my patient, and I'm going to dispose of that in the sharps container. So in the lab, your sharps container is over here, so I can still see everything. And since I did that one, I'm going to go ahead and do a glove to glove, skin to skin, do another medical hand wash. Okay, are you doing okay? You don't want to rub it. And so we gave that into your right arm because I gave it in the left one yesterday, and you normally give it in your abdomen. Okay. All right, the last one we're going to give is the Ketorolac, and we've already checked your pain, checked all the labs, and gave all the sites. And again, you said they gave it in the left. Okay, so we're going to give it in the right because we want to rotate sites. Even with your insulin at home, you want to rotate your sides so you're not always giving it. So you've got 4 quadrants, so you would give it in the 4 different ones. Okay. All right. So with these, you need to know your equipment. So this is the safety device. So before I get started, I'm going to pull that back. Okay. And I changed out the needle, so I had a good fresh needle. I've got the right size, which was the 22, and I've got the right length. This one is a 1.5. You would base that based on how much subcutaneous that you had to get through to get to the muscle, because we want it to go to the muscle. The recommendation these days is not to aspirate. Aspirate means I would, once I injected it, pull back on the plunger, check to see if I had any blood, and if I did, I would take it out. But the recommendation anymore is not to aspirate. However, there are some medications that are IM that it specifically says in the drug book that you need to aspirate, okay? So aspirate again means just pull it back, and if you didn't have any blood, then you could go ahead and give it, okay? We're also going to be giving this Z-Track. So if I were just to go through the subcutaneous tissue into the muscle and then take it out, that medication could actually come back up through that tract into the subcutaneous tissue, and some IM medications can cause necrotic tissue or dying tissue, so we don't want to do that. So Z-Track, we're going to pull the subcutaneous tissue to the side. We're going to go in at a 90-degree angle. I'm going to support it. Now you want to give with 1 ml at least over about 10 seconds, so slowly. Then once I give all of it, we're going to wait 10 seconds, okay? And then we're going to pull it out, which then, as I'm pulling it out, that tissue slides back into place, which locks that medicine into the muscle. Okay, again, making sure we still have our 1 ml. Okay, we're going to pull the tissue to the side. We're going to clean from the inside out. Okay, you want to make sure you don't cross over what you just got through cleaning. Okay, maintaining that spread there. And so I'm going to go in the middle of where I just got through doing that. So on the count of 3, you want a quick darting motion that's less painful. 1, 2, 3, all the way to the hub. I'm going to slowly inject for my 10 seconds. Once I slowly inject it, I'm going to wait 10 seconds. And I'm going to pull out at the same time. And I'm going to deploy my safety immediately. Okay? Making sure we're not rubbing it or anything like that. Making sure there's not any blood. And then I'm going to take this straight to the sharps container. Again, I know my patient is good. And so I'm just going to walk here. Dispose of it. Okay, and then I'm going to do glove to glove, skin to skin. I'm going to do a medical hand wash. Get all of my stuff. Get the bed back into a low position. And since we gave that PO medicine, we want to at least let our patient sit up for about 20 to 30 minutes. And the fact that we're going to be bringing your breakfast in here shortly for you to eat, because we gave you that insulin, okay? And then we'll be checking back within 30 minutes for all meds, but then a minute or an hour to 2 hours for the onset of the MPH, and then 4 to 12 on the peak. So we'll be checking to make sure that you're not having any problems with hypoglycemia at that point, okay? And again, before you get up, make sure you call for help, and we're going to put you on fall precautions on that. Okay, so once we have done all of that, been in low position, do you have any questions before? Okay, so I'm going to come over here and I'm going to go ahead and document. So we've done our 3 checks, 5 rights, 3 checks, and we scanned our patients, scanned our medications. Now I need to document. So with insulin, we need to, I'm going to put my JB, because that means I gave that medicine at 9 o'clock. The other thing I'm going to put is that we gave it in the right upper arm. So right upper arm, okay? I don't have to put sub-Q because it's saying I'm giving this sub-Q. I just need to have the location so the nurse that's giving it next time, and if I'm not here, then they can look, oh, they gave it, maybe my patient wasn't able to tell them where it was, then they can always look to see, and then they know who gave that medication. So at 1800, whoever the nurse is giving that would know, okay, we need to rotate sides, okay? So I put my JB, I put my, where the location is, okay, in my Ketorolac, okay, my JB that I gave it, okay, and we gave it in the right ventral gluteal. Okay, and we don't have to put IM because it's already saying we've got IM again, so the next nurse knows where it was given and who gave it, okay? And then in my metoprolol, I need to put my JB because I gave it, but I also need to put the apical, let me spell it right, pulse was 80, okay? My BP was 120/80, and all of that met the parameters of me being able to give it, because if it had been less than 60 apical pulse, I would not be able to give it, because metoprolol beta blocker decreases the pulse, and then it decreases the blood pressure. So if the systolic blood pressure was less than 100, we would have had to held it, but the systolic was 100, so we were able to give it. Okay, so once I have documented that I gave all of the medications, in the hospital you can hit save. Okay, also in the hospital there's drop downs on the computer screen, unless there's a cyberware. And so you drop down and it'll give you specific locations that you can click. The other thing about documenting is that we would document that and you don't do it here, you would do it in another spot on the MAR, that you taught your patient about the medication, and did the patient verbalize back any understanding or any, did they have any questions about that? So once I've done all that documentation, I've made sure everything is complete, I'm going to go ahead and shut down my computer. I'm going to take my medications. I'll make sure, again, the bed is in the lowest position, side rails are up ×2, the call light was in reach, and the wheels are locked, which they are. You've got some water. Again, we're going to be bringing your breakfast here shortly, and we're going to get you a yellow gown, a fall bracelet, and some non-skid socks. We're going to put a sign up, so make sure you call before you get up, because again, that metoprolol may make you a little bit dizzy, okay? Lightheaded, and we don't want you to fall on us, all right? Do you have any other questions? Okay, so as I leave the room, I'm going to go ahead and do my medical hand wash. And exit the room.